Well, let me first tell you, my health center, I'm the CEO of a health center. My health center serves 7 rural counties in South Carolina, about 30,000 unduplicated patients, and many of them are the most vulnerable patients in the area. I have been working and advocating on behalf of not only protecting, but strengthening the 340B program for at least 15 years now. And my pharmacy, we have 2 in-house pharmacies plus about 35 contract pharmacies. But we feel like the assault has really posed 2 major threats. Number one is that what's at stake is limiting access to necessary, affordable prescription medications to the most vulnerable patients in our country. And the second is reducing the resources that the safety net has to provide comprehensive services at their current level. Who's going to fill a gap if that margin from 340B continues to shrink and be diverted to unintended for-profit entities? So it's been a fight. Why did I feel committed to join and to participate with CV 340B, Community Voices for 340B? Because there's one group of stakeholders, partners, if you will, that's really an untapped resource, and that's our community. And I have actually said to neighbors, well, we're a 340B pharmacy, and there's just this blank look across their face. So I've explained what 340B is, but if we're able to do that on a national scale and really not only educate the communities that we serve, but engage them in protecting this program, we become so much more powerful. We're a grantee. I'm not a hospital. My career spans hospitals and a couple of academic medical centers. And one of the things I learned throughout my career was the importance of our working together. I'm sort of synonymous with a trinity that I use early on. I used this trinity teaching other health center leaders about the value of 340B. And it was access to affordable medication is a primary driver of improved clinical outcomes, which in turn, I used to say, drives financial viability because it helps us financially. After about 2 or 3 years, I began adjusting that to access to affordable medication, prescription medication drives improved clinical outcomes. It also supports those resources that enable us to provide more comprehensive services, which in turn strengthens the capacity of the overall healthcare delivery system. It's not just my health center that my patients depend on, it's my partner hospitals. And 340B is an essential part of making sure that together we can provide the scope of services that addresses all their needs. So we've got to be in this together. I'm looking forward to serving on the steering committee. I was invited to do so and enthusiastically accepted that honor and responsibility. But I'm looking forward to working with many of you so that we can move this national campaign forward.